Well, the holiday season has begun, which means mental illness symptoms could rise for the nearly quarter of Coloradans with a mental illness, as well as those dealing with the unavoidable holiday stress and grief. This morning, 90s wellness expert Dr. Heather Hans joins us to discuss how accepting your reality can reduce negative emotions. Dr. Hans, thanks for being with us.
Thanks for having me.
So how does acceptance factor into all of this?
Yeah, this is actually a really powerful technique that helps even the most difficult mental illnesses like PTSD, addiction, personality disorders, suicidal behaviors. And so it also helps with general anxiety and depression, even situational over the holidays. And it's really about accepting the present moment exactly as it is by not trying to change it, looking at the past and just getting through hard times, you know, even if you don't like the way things are.
Right.
And really, it means that you accept it and you accept yourself without any judgment or blame or bitterness. And from there, we can make changes.
Yeah, exactly. I am going to change something in the moment, though. We're going to scratch it up against the mic just really quickly. Acceptance is not so easy to come by when you're in the moment, you know, like you have these feelings come up. How do you go about finding acceptance when you're kind of in the midst of your own storm?
Yeah, absolutely. So I know it seems easier said than done, but I promise it gets easier with practice. So the first thing is to accept the actual facts of the past and present. So usually there's a cause for everything, and you can look back, look at those facts, and know that, you know, life is still worth living. And the future is full of possibilities. So all we need to accept about the future are very basic limitations, you know, realistic limitations. The other thing is to act the way you would if you accepted the facts. So for example, acting unaffected when someone annoys you, or
is it kind of like a fake it till you make it attitude? Kind of like you're acting unfazed and you become unfazed?
Yes, and that's how the brain works, is that through repetition, even if you're faking it, you still are changing it. And so acting like you're unaffected, trying not to say, well, you should do this or shouldn't do this, and noticing when you're saying that to yourself, things shouldn't be this way, you know, all of that is resistance. And so you want to say, well, how would I act if I did accept it? And then start doing that. And then one more thing is to focus on your physical body sensations, both your feelings and your physical sensations, almost as if you were an unbiased scientist, just kind of noticing what the details are. And then from there, you can use imagery, you can use relaxation techniques, you can use self-affirming talk, because always the way out of the pain is through it.
Yes, I want to ask a little bit more about that last thing you mentioned about recognizing your physical movements and everything like that. What do you mean exactly by that?
Yeah, so let's say you're feeling irritated by someone. You would want to notice, what does irritation feel like? Maybe my heart is racing, maybe my muscles are getting tense. Because if you focus on just the sensations rather than the emotions, it helps you deal with them easier.
Okay, you almost need to take like a mental journal of how you react to things in the moment, what that feels like, so you can remember that next time around.
Yes, exactly. Great question.
Okay, perfect. Well, I know I need this. That's why I'm asking.
We all do.
I kind of am using this as my own little cheap therapy right now. Exactly. Well, Dr. Hans, thank you so much. Where can more people get more information if they'd like to learn more about this?
Yeah, so therapists who specialize in DBT, that stands for dialectical behavioral therapy. Also, here are two quick tricks. So if you're feeling anger, you put your hands like this, kind of like little cups. You could even just rest them on your hands or by your side under the dinner table, wherever you are. That actually diffuses anger.
What is it about that position? Do we know?
I think it's called willing hands, and it's more of a receptive position rather than an aggressive. So something about the wiring. And then the other thing is, if you're feeling a lot of shame, the thing that diffuses that is to talk about your shame, of course, with someone trusted. So yeah, don't keep it in.
You know what I noticed when I had my hands like that too? I almost feel like better airflow coming through too.
Oh yeah.
Like it's like circulation situation,
right?
Who knows?
Open.
Dr. Hans, thank you so much.
My
that was
pleasure.
very
Thank
enlightening.
you.
Appreciate it.